Welcome to the ATLS certification overview. Advanced Trauma Life Support represents the gold standard in trauma care education, preparing healthcare professionals to deliver life-saving interventions in critical situations. ATLS providers are the foundation of acute trauma care in emergency and trauma settings. Your core responsibilities include systematic primary and secondary trauma assessment, rapid identification of life-threatening injuries, prioritized interventions following the ABCDE approach, effective trauma team leadership and communication, critical decision-making during the golden hour, and patient stabilization and preparation for transfer. Certification is issued by the American College of Surgeons and international equivalents. Training requirements include a 2 to 2.5 day intensive interactive course format with comprehensive lectures on trauma management, hands-on skill stations in simulated settings, interactive discussions on case scenarios, practical skills assessment with mannequins, and up to 19.5 CME hours awarded upon completion. Your certification assessment includes two critical components: a written examination with 40 multiple-choice questions, providing comprehensive assessment of trauma management knowledge, and skills assessment with 4 to 5 simulated clinical scenarios demonstrating hands-on competency in realistic settings. You must pass both components. The written examination allows 45 to 60 minutes to complete 36 to 40 multiple-choice questions, requiring a passing score of 80% or higher. This covers all aspects of ATLS protocols and systematic trauma assessment. The skills assessment allows 25 to 30 minutes in station-based scenarios, requiring demonstration of all essential steps. This demonstrates practical application of ATLS principles in simulated trauma scenarios. Both components must be successfully completed for certification. The ATLS curriculum covers 7 essential areas. Initial assessment comprises 30%, airway and ventilation represents 20%, shock management accounts for 15%, adjuncts and secondary survey make up 10%, head, neck, and spine injuries comprise 10%, musculoskeletal trauma represents 10%, and pediatric, pregnant, and elderly trauma complete the remaining 5%. Essential skills are divided into 2 categories. Safety and technical skills include scene safety assessment, PPE use, airway management, hemorrhage control, cervical spine immobilization, and equipment safety. Patient care skills encompass primary and secondary surveys, teamwork and communication, real-time decision-making, prioritization, and thorough documentation of care provided. Let's apply your knowledge with a trauma scenario. When conducting an ATLS primary survey, which assessment takes absolute priority? Remember, the ABCDE approach always begins with airway assessment as the foundation of trauma care. The correct answer is airway assessment. In ATLS protocol, airway is always assessed first during the primary survey. This systematic approach ensures life-threatening conditions are identified and managed in order of priority. ATLS providers work in 3 primary settings. Emergency departments provide frontline trauma care with varied case complexity. Trauma centers offer specialized care with advanced resources and multidisciplinary teams. Pre-hospital settings require rapid assessment and stabilization before transport to definitive care facilities. Critical safety protocols include universal precautions for all patient contact, proper PPE use throughout trauma care, meticulous hand hygiene before and after procedures, safe sharps handling during interventions, and appropriate isolation protocols when indicated. Effective trauma communication requires closed-loop communication to confirm understanding, clear orders during resuscitation, defined team roles for efficiency, standardized protocols like SBAR for reporting, accurate documentation of interventions, and regular team huddles for coordination and debriefing. Ethical principles in trauma care include respect for patient autonomy even in critical situations, maintaining confidentiality of sensitive information, obtaining informed consent when possible, supporting family presence during resuscitation, applying ethics in resource-limited settings, and honoring advance directives when known. Successful ATLS preparation combines multiple approaches: active manual reading of course materials, spaced repetition for knowledge retention, simulated scenarios for practical application, role-based practice with team members, utilization of digital and online resources, and video demonstrations of critical skills and procedures. ATLS certification remains valid for 4 years. Renewal requires a refresher course, typically a half-day format, passing both written and skills assessments, earning 5.5 CME credits, participating in simulation drills, and ensuring recertification occurs before expiration. Here's your ATLS certification summary. The exam includes up to 40 multiple-choice questions with 80% passing, plus 4 to 5 skills stations. Core content covers initial assessment at 30%, airway and ventilation at 20%, and shock management at 15%. Key skills include airway management, chest trauma interventions, and hemorrhage control. Certification is valid for 4 years with half-day refresher courses. You'll work in emergency departments, trauma centers, and pre-hospital settings. Use the ATLS student manual, practice questions, and simulation workshops for preparation.